Hello there, televiewers. We trust that you're having a lovely afternoon. Well, it's a pleasure to be in your company this Tuesday, and it's a special edition of the diary. Special because it's not usually on this day and this time that we come on your screens, but well, like I've said before, special situations call for special measures, which is why we are having this special edition of the diary. Well, it's been I think 4 days now since we got our last update on the coronavirus from the Minister of Public Health in Cameroon. We have gone to over 800 cases of the coronavirus in Cameroon. And beginning yesterday, it is now compulsory to wear a face mask in public places. Now, those who fail to respect the measure put in place by government will be fined. We'll be talking about all of that in this edition of the diary. So don't go away. When you come back, or when we come back, you will be meeting my guests on today's edition. Don't go away. Welcome back. If you're just joining us, you're watching the diary on STV. It's a special edition, and the focus, of course, is on the updates of the coronavirus in Cameroon. I am not alone in the studio on set. I am very glad to be receiving again Dr. Anita Nguti. Of course, she's a medical doctor, and she's the infection prevention focal point at the Mbopi Baptist Hospital in Douala. I'm looking at your face, and you're smirking quite a little. Did I say that right?
No, you said it right.
Okay, fine. I said that right. And while it's going to be myself and you, Dr. Anita, on set, we're going to be joined later on the show by Esther Nguti Anita. She's the anchor of the daily TV program Africa 54 on the VOA. She'll be joining us to give us some updates on the coronavirus out of Cameroon. We have a few questions we've prepared for her. Now, we're going to go straight into today's discussion. I do believe that's a confirmation. I do believe that we're trying to get everything working technically so that we'll be able to speak with Esther Nguti Anita, like I announced earlier, who is joining us from the VOA. She'll be giving us some updates. We are glad to know that she's standing by. Soon we'll be able to interview her. But for now, Dr. Anita, I'm going to start with you. And my first question is this. What's your evaluation of the coronavirus pandemic in Cameroon so far?
We were faced with this COVID-19. It started in March in Cameroon.
Yeah.
And so far, we have been having increasing number of cases. Sometimes the level to which it was increasing was a bit worrisome, because of the massive testing that was going on, that the ministry told us was going on. So, but generally, I would say that Cameroonians are becoming more alert to it. You see that evidence when you go around and you see everybody putting on the mask, trying to put in the little measures that they can put at their own levels. So I would say that Cameroonians are also prepared. They are getting prepared for it, even though I would say the preparedness is not to the maximum, but we are getting prepared, and we are receiving it. We are getting settled about it gradually. The anxiety and the panic is reducing as the days go by with some people, and it's a good thing. So I would say that as at now, I will not say we are ready to face it, but we are ready to receive it.
Right. And as far as the figures go, were you surprised at how much the number of cases increased, or did you see it coming?
Well, when the cases started, and with the news that was going around, with the people not wanting to go in, those that came in out of the country who were exposed, coming in from countries that have high spread of the virus, who did not want to go up for testing, with all of that, we were already anticipating that there will be an explosion because the infectivity of coronavirus, at least one person has the ability to infect 3 people. And each of those 3 people have the ability to infect 3 people, at least 3 people. So with that, given in mind, given the time that they stayed without coming up for testing and all that, the values are not surprising. At a certain point, we felt like they were not even a representative of the actual numbers because maybe other people are not yet symptomatic and have not yet gone up for testing.
Right. But the thing is, recently, we're not getting any numbers from the minister. It's been 4 days. I mean, before the past couple of days, we had the habit of getting the daily updates from the minister, the new figures, the new infections, the persons who have recovered, as well as those who have died. But for the past 4 days, it's complete silence. And I'm guessing people are wondering, why is it that we're not getting the numbers anymore?
Well, I would say that there is testing going on for the patients. We are referring patients from our center because we don't do testing in Poppy Baptist Hospital. We refer, and there are patients going there and they are collecting samples. So we will say that they are being tested. And so about the report of the cases, from an interview that we saw the minister, it's like the minister decided not to report again the cases. I don't know for the reason why. Maybe it's to reduce the panic that was circulating as the cases kept on going on. But I'm sure that hopefully they will tell us the situation of cases.
Yeah, we definitely hope that, because it's important that Cameroonians know the figures then. They know what's happening. So we are not just in the dark. Like you said, hopefully we'll get the numbers soon. We announced earlier on today on the show that we'll be having the pleasure, actually, of speaking with Esther Nguti Anita. And like I said, she's the anchor of the daily TV program Africa 54. That's on the VOA, the Voice of America. She's joining us now live on the show. We have a few questions that we have prepared for her. Hello, Esther. Good afternoon. Thank you very much for joining us.
Thank you for having me.
We hope that you're staying safe.
Yes, we are.
Right. So my first question is this. Very quickly, what's the update on the situation of the corona pandemic in the United States?
Unfortunately, Mumba, in the United States, in fact, the United States is leading in the global coronavirus cases. And the New York State is the epicenter of the coronavirus. We have about 195,000 infected people in New York State, and about 23,000 deaths in that state alone. So, as Andrew Cuomo, the governor of New York State, saying the worst is over. They are observing some of the medical experts' advice on social distancing, and so the numbers are beginning to slow down. Numbers of infections slow down. I hope you can hear me well.
Right. Now, in Africa, some countries like Cameroon are learning from scratch on how to cope with a pandemic like this. Now, is there anything that these countries can learn from the example of the U.S.?
I think there are a number of things that we people from Africa and Africans can learn from what's going on here in the United States. Social distance is really what. It also means people have to observe basic hygiene, especially washing hands. If you have a sneeze or you wait on your elbow, use a tissue and that tissue in some place where wash. Make sure you wash your hands. Keep your distance. And what you're doing here is very, I can tell you from a standpoint here, that there are fewer public transportation. Like buses don't run everywhere. The trains are not running. There are very few that limited. And even if there, it means there could be just a few traveling inside the train, meaning that one person is seated in one corner of the bus, another one in the middle, and another one somewhere else in the back. People are wearing masks. People are carrying hand sanitizer. So people are being very careful. And I think maybe we can borrow from that. And I think maybe the authorities or the African leaders need to do is make sure that people have access to hand sanitizer. People are able to social distance in the stores, as we call it here, or shops. If you're going to grocery shop, that's when you need to try to avoid the stores when you don't need to. And they have made clear marks of 6 feet between each people. You cannot stand right next to someone. You have to keep a 6 feet difference. And it's clearly marked when you're shopping, when you're going to pay for your groceries. This is the distance you have to keep. Remember, people are wearing masks. They're observing hygiene, measures possible. One of the stores that they are disinfecting it and shopping before they hand it over. So those are very important measures for the African people, our people, to follow in order to keep themselves safe and healthy.
Right. Thank you very much, Esther. Now, my next question is this. Many have been predicting that the pandemic is going to hit Africa, the virus is going to hit Africa really hard. And someone even said there are going to be dead bodies on the streets of Africa. Now, what do you think about this? Because some Africans have been saying that if we're looking at the figures this far, the number of infections on the continent, we're just above 15,000, and the number of deaths on the continent, and compared to what's happening in Europe and in the US, well, it should be the other way around, or maybe the other continents and other countries should be learning something from Africa. What's your opinion on this?
Moma, I would say I don't have a crystal ball on that one, and I'm not a medical. But one of the things I would say about it, because when people think about New York, why are there so many infections? People have to remember that African cities don't have as many in their own little cities as we have here in the UK. New York alone has more than 8 million people. So you can imagine if one person is infected and they travel to maybe a grocery store, or and they go to a place where it's crowded, chances are they are going to infect someone. Now, I do not expect there will be many infected in Africa. And I think that is probably not a good prediction that some of people in Africa will infect. Probably not going to happen. We don't see those numbers yet. And I think because the people are not concentrated in people, what Africans need to do is observe this hygiene and don't go to crowded places. And I give the government's advice. And the other thing I would say, as one who comes from Africa, is public address system always need to work. And if the government in Africa will ask health issues to go to village, speak to people who are public addresses, but there's probably just a time and the health issues speaking on the back and explaining in their language what needs to be done if people are getting infected. I think what would be very information to keep the African population safe. On the other hand, on the economic, I'm emphasizing this is huge for Africa, and it is huge, right? I would think that African should actually and money to forgive the debt, so that the African countries, with their limited resources, can deal with their little money to have without their population.
Right. Thank you very much. Next, I'm a little curious about this. Now, Americans have been in confinement for a couple of weeks. In Africa, some countries still, some states in some countries, yes. In Cameroon, not just yet. We don't know if it's going to happen at all. So, how are Americans managing confinement? What's working? What's working for Americans?
America is a huge economy. One of the things I can tell you, I am working from home. Most of us in North America are working from home. I cannot remember the last time I saw electricity in the house. So many Americans are able to work online, through their computers, through their electronic devices. Obviously, not all jobs can be done from home. There are some jobs that are physically there, and those ones can be. But a lot of people are staying home. A lot of people are living in a place that they don't need. In fact, even hospitals are doing video conferencing with, so that if you don't really, they will prescribe medication for you. You can come and you can go online home because our and not your office. Some people do have, but in America, your mail right. So I just did that. So those are variations in what can happen in Africa, in the US. The lockdown is in keeping away from eating with us. You don't know who is infected, has been infected today. Remember, even those the drop in the air, meaning to make infected means that you can breathe in so wearing of mask, keeping yourself, avoiding places, washing of hands, anything you can do, and
all right, and this final one before we let go of you, Esther. Maybe I'm being too optimistic. Well, I'm going to ask anyway. Are there any news, or is there any news on any promise of any vaccine that could be available in the near future?
Well, Moma, that's what everybody is hoping. A few hours ago, about 3 hours ago, so in China, they have 2 trials. I want to stress the word trial team. It's more than a done deal. There are so many pharmaceutical leading scientists and different ones, including the GlaxoSmithKline and they're partnering with other countries. Here in the US, leading scientists and collective, we do not have any vaccine yet. And remember, even when they have those vaccines, they will have to be tried. It will be over 6 months to a year, or even more, for them to be sure this vaccine works for human beings. So we are yet to test, but I can say, leading scientists, they are really working efficiently. Get rid of this pandemic. We're very the main practice what we're doing to keep this COVID-19 spreading further in humanity.
We all hope to see, or hope for that time when there's an available vaccine and we can truly say we are beating the coronavirus. Thank you very much, Esther. It was a pleasure to have you on the diary today on STV in Cameroon. Hopefully, we'll be able to get you on other editions of the show. Why not?
Sure. Thank you so much. And Cameroonians, keep safe. Social distancing. Pray for the save us all.
Thank you very much. You too, stay safe. And well, televiewers, that was Esther Nguti Anita. She joined us from the United States of America, from New York. And of course, she gave us the updates. We hope that you picked something from that interview. We are going to continue here on set. But before I resume my very interesting discussion with you, Dr. Anita, I propose that we go watch this report on the wearing of face masks. We were saying when the show started that it's now obligatory for every Cameroonian to have a face mask on when you're in the public. Once you leave your house, you have to cover your nose and your mouth, and you have to wear it properly. Now, those who fail to respect these measures are going to be fined 6,000 francs CFA if you do not have a mask on at all, and 2,000 francs CFA if you're not properly wearing your mask. So how have Cameroonians been reacting to this new measure? Let's go watch this report by Oni Ladonette, and of course, the show continues right after that.
It is the first Monday after the wearing of face mask was made mandatory by the Prime Minister, Chief Joseph Dianguti, to all Cameroonians in all public places. Moving around the city, one can easily notice most inhabitants putting on different face masks. At the Dokoti runabout in the Douala 3 municipality, its users attest their consciousness to the existing pandemic and the need to protect themselves and those around them. Some are still doubting the existence of the virus, but it truly exists. We have to buy it because it's to protect ourselves. If there are people saying face masks limit respiration, it's true, it blocks respiration, but it's for our health. I need to protect myself. The new imposition of face masks coupled with the scarcity of surgical masks at pharmacists has influenced the production of locally made face masks.
Il y avait des cache-nez pharmaceutiques là, qui se faisaient de plus en plus rares. Bon, c'est assez.
Before, we had the surgical masks sold at pharmacies, which became really scarce. We thought of how to work with fabrics. We buy new fabrics and cut into pieces and then join them.
D'améliorer jusqu'à ce que vous voyez là. On achète déjà carrément des tissus neufs. On découpe et puis on monte.
This has attracted many city dwellers in engaging in such business. I sell face masks ever since the outbreak of the COVID-19. There's a high demand, especially today. It's 200 francs. At this time, I could sell 40, but today I'm at 60.
Je le fais depuis l'annonce de cette pandémie.
I sell since the outbreak of the COVID-19. There's a high demand since this morning because it's personal and it's for our health.
La santé, c'est d'avance personnel.
Face mask, once thought of as an unnecessary precaution for healthy people during the early stages of the pandemic, is now mandatory in most places all over the world.
Thank you very much, Oni Ladenet, for that report. And we could gather, Dr. Anita, that Cameroonians are reacting positively to the wearing of face masks. Many people, following or respecting the measure. And you were saying something that a good thing that has happened is face masks that are homemade that still serve a purpose in this pandemic.
Yeah, I see that Cameroonians are getting more comfortable with it because of the fact that they can prepare it in their houses or they can easily access it, and it's cheaper compared to the surgical mask that was there. And this mask can also serve a purpose because one of the main reasons why the CDC, the Center for Disease Control, prescribed this mask is because social distancing is very difficult in some places, like in the markets, like in supermarkets or other places.
Yeah.
And in Africa, to achieve social distance is very difficult. In the village setting, you can easily get that because villages, the houses are spotted, but they still have places where people gather a lot. Yeah. And it's in those cases that the masks are really useful.
Right.
So that's one of the reasons why the CDC recommended that they can start doing homemade masks. And the homemade mask is also good because it's not single use.
Yeah.
You can use it, you wash and you reuse it.
Right. Now, another thing I'd like to say at this point is that televiewers, so if you are watching us, it's okay for you to call. It's that time on the show when you can call and ask questions or make a comment, just contribute to the show. The numbers will be up any minute now, and feel free to call us, and we would like to hear from you. Now, while we're waiting to get the calls, Dr. Anita, another thing I wanted to talk about, I mean, when when we had the first cases, the early cases in Cameroon, and up until, say, a week or so ago, now, the general belief was, except you're sick, except you're coughing, you're sneezing, you're really sick, or you're a medical personnel, you do not need to wear a mask. And we said that on the show so many times. Don't go get masks. You don't need them except you're sick. But things changed. Now, what happened? Why did it change? Why the shift from you don't need to wear masks except you're sick and or a medical personnel, and or to the point where we're saying everybody needs to wear a mask definitely? Why the shift? What happened?
So the first thing that we should understand is that this virus is new. And things are changing every day. They're discovering new things. Studies are being done. At the beginning, what they said was that the virus is still big. If you cough it, it will just go 1 meter and it will fall to the ground. It doesn't linger in the air. But later on, a study that was done and published by the New England Journal of Medicine, it said that this virus could stay in the air for about 3 hours. So with around 3 hours. So with that, you discover that you can still walk around now, and the virus, if somebody coughs in the air, the virus can still stay for that 3 hours and you can get infected. So with that in mind, and also still back on the fact about the social distancing, because if we can achieve social distancing, if you can achieve confinement, you don't need a mask except you are taking care of the patient or except you are the patient. So that still stands, but with the new developments, with the new studies that are coming up, because it's not yet confirmed for how long the virus can even stay in the air. The study, they just said that after 3 hours, because this study, they used the SARS-CoV-1 and SARS-CoV-2, and they exposed it to the air, and after 3 hours, they come and measure the titers of the virus in the air, and they discovered that after 3 hours, the virus was still there, viable viruses that could still infect. So it's because of that that they started suggesting that everybody should wear a mask if you are going to areas where that are crowded. And if you that is infected, or you that have symptoms, if you can practice cough etiquette, you cough into your shoulder or you cough into a tissue, or you wear a mask if you have symptoms, definitely someone who is not sick will not need a mask. But the truth is just that that's the reality we're living in. Yeah. People will still just cough into the air, and they will speak. Even when they are speaking, they can still infect you. So if you have the symptoms now, you put on the mask. If you put on the mask, those that are around are somehow safe. So, yeah.
There's another thing. I'm not the expert, so I don't know. You'll probably be able to explain that to me and to our televiewers. It's this. We've been reading and we've been hearing that even when you do not show the symptoms of the virus, and you have it in you, and you talk, you can still infect people. So maybe I was thinking maybe that's another reason why it's important that people wear masks all the time.
Exactly. That's one problem. That's one reason also. And this virus, there are no guarantees around this virus, because they just the other day they said on the CNN that even when you recover, there's still a chance that you can be infectious.
Reinfected.
Not reinfected. You can be infectious, like you have.
Oh yes.
Yes. So there's a possibility that you can be infectious. So what they recommend is, if you have been internalized and treated for COVID-19 and you go back, it's better you continue to practice the preventive measures. You put on your mask and you clean the surfaces regularly, and you maintain social distancing. When you're with people, they should put on their mask and all that. So there are no guarantees really around this virus. We just need to be open to new information. That's one of the main recommendations of CDC. Get the new information and adapt to it, and we'll keep moving on.
Right. And another thing concerning the matter, another issue is I noticed personally that before the fines came in, before the threat of you're going to be sanctioned, you're going to be fined, not everybody was, jumping about the idea of wearing a mask. But since the minister announced that they were going to be sanctioned and people will be punished, penalized if they did not wear the mask, now many more people, almost everybody on the street has a mask on. Now, do you think Cameroonians are respecting the measure because they're afraid of the fines, or Cameroonians are just really conscious and they are aware of the fact that they need to wear the mask to protect themselves and to protect others? What do you think is inspiring them?
Like motivation. There are 3 ways that people get motivated. They can either be motivated with the carrot, like the carrot and the donkey, or they are motivated with the cane, or they are motivated when they see reason. There are some Cameroonians that their motivation for putting on the mask is that they have seen reason. It's not necessarily the fine, but there are others that it's the fine. Because you find, like, let me give for example, the hospital. There are people coming to the hospitals, some will just put on their mask. Even before the minister said it, they put on their mask and even wear gloves. Others will just come in. Even now that the minister has said it, they still come in like that. we are the ones who insist that they should go and look for a mask. At least in the hospital premises, you should have it. If you don't have it anywhere else, you should have it in the hospital, because that's where, if anybody is sick of it, the person will come to the hospital. So there you should take more measures. So we cannot say, but there are some people that we can say for sure that they are motivated because they are afraid of the fine, and there are some people that are motivated because they have seen reasons.
Right. Now, time to remind our televiewers again that we're open to receiving their calls. The numbers are now up on your screen. Feel free to call us if you have a question, if you have a comment to make, or just any contribution to the show. We'll be glad to hear from you. Dr. Anita is here at your disposal, ready to take on whatever questions you may have. Now, let's continue talking, Dr. Anita, as we wait for the calls to get in. Now, you know, the situation is developing. There are updates on a daily. Now, as a medical practitioner, one who has had to come face to face, you know, with patients and dealing with the virus, are there any new recommendations that you will make as per the fight of the spread of COVID-19 in Cameroon? Do you have any new recommendations?
Recommendations to the population or to
anybody, the population, you know, medical personnel, all the stakeholders involved in the fight against the coronavirus?
I will say that first, as for health professionals, we should become more and more vigilant about it. And now it's a bit difficult for us on our part because this can cause pneumonia. But we used to have patients that have pneumonia. We don't know now if this pneumonia is bacterial pneumonia or viral pneumonia. So we should always have a high index of suspicion, and we screen the patients, and patients that are at risk, we refer the patients. And when referring the patients, it's always very important to still talk to the patients and make them understand.
Okay, we have a call on the line. Hello, good evening, sir. You're welcome on board the diary. What's your name and what's your contribution?
Hello?
Hello? Yes, sir. We hear you just fine. You're welcome on board the diary. What's your name and what's your contribution?
Hello, my name is Mr. Benjamin from Cameroon, Nigeria.
Oh, we're glad to have you on the diary, sir. What contributions would you like to make to the show today?
Hello?
Yes, hello, sir. Go on. You have our attention. Hello? I think we just might have lost that caller. It's unfortunate. So please feel free to call back. Feel free to call again. We'd like to know what you think. And there are a thing or two we could learn from Nigeria, you know. I was reading recently the figures in Nigeria. They are, I think, just above 300 plus. And I mean, Nigeria picked up picked the first case of the coronavirus before Cameroon did. And they're still at 300 plus. Well, let me make sure I have the exact figures. I do believe, I have it somewhere in my notes, I do believe the figures in Nigeria, 343 cases, and with 91 recoveries, and as well as 10 deaths. Yes, okay, we have another call on the line, we'll come back to that. Hello, good evening, you're welcome on board the diary. What's your name and what contribution would you like to make to the show today?
My name is Joseph from Airborne.
Okay, sir. Quickly before we continue, could you please move away from your receiver, from your TV set, or turn down the volume? You can hear us just fine through the phone. If you could turn down the volume, and then the communication would be better. Yes, I think it's better now. Let's go on with your contribution, sir. Okay, it seems we lost that caller. Just general information. If you're trying to contact us on the show, it's best for you to move away from your TV set, or you turn down the volume. You can hear us talking just fine on the phone. You don't have to be close to the TV, or you don't have to turn the volume up to hear what we're saying. So turn down the volume of your receiver, or you move away from the TV. That way we can better communicate. And I was saying, Dr. Anita.
Hello.
Okay, another caller. Hello. Good evening, madam. You're welcome aboard the diary.
Good evening, madam. I'm Zakewang SM.
You're welcome about the
Please,
diary.
I just want to ask, as they said, social distances. That we maybe when we are living in one room, as we are living in one room, how can we prevent it? Or we should put the mask, or we should do how?
Okay, thank you very much, madam, for that question. Thank you so much for calling. We are grateful. Now, Dr. Anita is going to answer that question for social distancing. How do you do that in a small space with many people?
Social distancing, the idea behind it is to distance yourself from people outside your house, not in your house. But if you have somebody that is infected in your house, then you have to practice the social distancing from that person. Now, to know if that person in your house is infected or not is a question that is difficult to answer. So, but if somebody already starts having symptoms, it's better that maybe you look for an isolation room and you keep the person there, and the person avoids using the same utensils as you, and you disinfect surfaces that are frequently touched more often, things like your remote, your phone, the doorknobs, or the tables. And if the person they should not use like one spoon to dish food for everybody.
Okay, we have another call on the line. Hello, good evening, madam. You're welcome about the diary.
I'm calling from Linde. My name is Madam Tabi.
Oh, Madam Tabi, we're glad to have you on the diary.
Yes,
What's your contribution?
I have a question for the doctor.
Please go on.
Yes, I wanted to ask something that for the person who has cyanosis, what are the precautions that the person can take? Because for now, if you sneeze, everybody will like run away from you. Say, yeah, it's coronavirus, you have the disease, so I don't really know.
Okay. Thank you very much, madam. That's a very good question. And thankfully, we have Dr. Anita here and said to answer that question. So, Dr. Anita, if you have sinuses, your nose is running all the time, you're sneezing all the time, what do you do?
Well, there's nothing that you can do, but it's just to protect yourself too, not to get infected. But people also have to understand that people can have other things and not corona. But the focus of these preventive measures is not only to prevent the spread of corona, it's to prevent the spread of other respiratory infections. So if your sinuses maybe is an allergic reaction, that's not infectious. But if it's an infection, you still need to practice the preventive measures. And people also need to understand that people can still have symptoms, respiratory symptoms, that is not corona. So it's not to start stigmatizing people.
Anybody sneezing or coughing.
Yes. So it's just to like, even if somebody is coughing around you, the person doesn't have a mask and is not coughing properly, it's your place to tell the person to do that or make a distance. Stay away.
I would move away.
Yes.
I would move away.
And even you with the sinuses, if you are beside somebody that is coughing, you should better step away because you with respiratory symptoms, it can get worse.
Okay. We have another call on the line. Hello, you're welcome aboard the diary. Thank you very much for calling. What's your name and what's your contribution?
Hello.
Yes, hello, sir. We can hear you loud and clear. What's your name and what's your contribution?
Yeah, my name is Prince Jack. I'm calling from Yaoundé.
Okay, thank you very much for calling. What's your contribution, sir?
Okay, I was just having a cold question to ask the doctor. This question is really bothering me sometimes about the coronavirus. I wanted to ask the doctor about, I know the virus, it's an airborne disease. You can't hide from it. And I think, and they said in a dry surface, it can be there for about 4 days. So I don't really understand how can we even really prevent this coronavirus. So it really bothers me, like even using the mask, when I know it's an airborne disease, something that floats, there's something on the air, something like that. So it really bothers me. I just want the doctor to clarify me, to give me some touch about the virus itself, because I know it's something. It's an airborne. How can you run away from it?
Okay, sir. Thank you. We understand your concerns, and thank you very much for sharing those concerns with us on the diary. And of course, I'm going to leave it up to you to answer, Dr. Anita.
I really understand his worry, because to have that in mind, it can be very burdensome for you to walk around knowing that no matter what you do, eventually you will get infected. But coronavirus has not been established as an airborne disease. Because even with the study that they did, after 3 hours, the titers that were in the air had reduced a lot. So because the virus is heavy, they are centimeters. For a virus to be considered airborne, the virus should be less than 5 micrometers in diameter. But coronavirus is bigger than that. Is between 5 and 10 micrometers. Okay. So even though it can stay in the air, but it will still drop on the ground. Now, the main thing about it being on surfaces is that we should constantly clean surfaces. You see, there are even some videos that we have passing on TV. You want to open the door, don't open the door with your hand like this, because if you open it, you can get the virus on your hand and you touch your nostrils and get infected. So it's to just make it a part of our lives that I don't open the door with my hand anymore. And if I open the door with my hand, I have my hand sanitizer and I sanitize immediately. If I touch any surface that I feel that is suspicious, I sanitize. Now the mask is there. If you are afraid that walking in the crowd, you can inhale the virus, you put on your mask. So to a certain extent, if you are conscious and you are practicing your preventive measures, you can be sure that you can evade getting infected with this virus. So it's just to integrate it in our lives. Like, I know that if I touch any surface, even I should constantly clean maybe my phones in the house, the doorknobs. And if I go somewhere, I touch the doorknob, I should sanitize my hand immediately. I should make sure my hands are always clean. So because sometimes some people, it's a reflex to touch their mouths, to touch their nostrils and their eyes. So the main thing is just to keep your hands clean, so that if they are going to touch your eyes, you are not worried. And you put on the mask as it has been recommended by the ministry.
Right. And just to add, we have to be careful about the information that we pick on social media or wherever. Do not just read and believe everything. Make sure your information is coming from solid, credible sources. Because assuming that the coronavirus was airborne, then even the advice to stay at home would be useless, because air would meet you in your home. But in countries around the world, people are being advised to stay home, not go out. It's a complete lockdown. It's to tell you that, you know, the virus cannot get to you in there if you don't have someone who brings the contamination. So we don't want to be too stressed, okay? Do not be too stressed, because that's the problem for you. It's not even good for your immune system if you're too stressed, and you need your immune system up and working. So before you start worrying over a piece of information, please make sure it's from a credible source. Now, any more questions, feel free to ask. We still have 30 minutes more or less to be with you on the show, so we'll be glad to answer all your questions. Feel free to call us. And we were talking about this earlier, before the call started shooting in, about the situation in Nigeria that have been able to maintain the cases at a low, at least for now. Do you think there's something they're doing that we're not doing here in Cameroon? Is there something we're missing from what they're doing? I mean, comparing the number of cases in Cameroon to that of Nigeria.
I will say that, I will not say that there's something that they are doing that we are not doing. I would say that before we can say that your numbers are going higher than mine, meanwhile I had the virus before you, we should have the same level of testing. Right. So it can still be that they have cases and they are not identifying the cases. Okay. So those ones are the confirmed cases that have come to them and they have tested. But it's still possible that there is something that they are doing that is working, that we can still learn from. So I don't know, there's no level of confinement in Nigeria. So basically we are almost at the same level of maybe the things that we are putting into place. So maybe the differences come with the intensity of testing.
Maybe, just maybe. We'll see what happens in the next couple of weeks. Hopefully we'll be, sharing positive news on the diary. Now, there's this question I asked Esther, who was on the show with us via Skype earlier on, and it is some people, billionaires, famous persons are assuming that the virus is going to hit Africa really hard, and there are going to be many people dying from the virus. What do you think about it as a medical doctor practicing in Cameroon?
Those are speculations. We cannot know for sure. Because there are other scientists that are saying that maybe the virus is not so severe in Africa because we have been exposed to malaria before and we have been taking quinine for a long time and all that. So there are many hypotheses. I'm not saying that because we have been having malaria, it's established that we will not have the virus. No, I'm not giving that information. But I'm saying that what they are saying is just a forecast, like it's possible. And they are giving that based on what's happening in their country. Because in their countries, it's hitting them so hard.
Yeah.
Yes, many people are dying, many people are getting sick. But there are so many things that are associated with the death pools of this virus. There are socioeconomic factors, and there are also epidemiology factors related to age. And if you look at Africa, even though we have old people, Africa is made up more of younger people. So before they made, there was an analysis in South Africa that was saying that maybe we might not have as much deaths as in other countries because of our population distribution. You have more young people, and so with them, the disparities are in different levels. We cannot just use one indices and just establish the fact that we are going to have dead bodies, but it's a possibility. So it's a fearful possibility, but it's not like that's what's going to happen.
Yeah,
anything but it's is possible. Yes.
Yeah, anything is possible. We want to stay positive. We want to stay hopeful and do the right things, and try in our own way to help curb the spread of the coronavirus. Another thing, I read a lot on the virus, of course, because before I come on air, I need to have as much information as possible. And I was reading that in the US, for example, 70% of the people who die from the virus are men over women, as in more men die. Is there a medical reason? Is there a biological reason to explain, well, pardon me if I'm wrong, why the virus is killing more men than women?
With medicine, there's always a reason that we could possibly give.
Okay.
And if you want to even look at dead posts, like even when we are in the hospital, if I see a man crying of pain and a woman crying of pain, I'll attend to the man first. Okay. Because women, they have a lower threshold of pain. Men can tolerate things for a long time. So it's possible also that one reason is that men hide their symptoms. They can, like maybe they just had malaise and fever. They keep just saying that, no, it will pass. It will pass. They are men. That's how they do it. And men also, they have a lot on their shoulders. And so they are more prone to cardiovascular diseases. So there are some cardiovascular diseases like that women start getting more prone to it when they reach menopause, meaning that when they become like a man. So there are other features like men, they are more prone to some cardiovascular, and we know cardiovascular disease is associated with a poor prognosis with the virus. So those are some of the reasons that could maybe explain why more men are dying.
Right. And I was listening to this interview by a doctor who wrote a book about the immune system of women as against that of men. And I'm sorry, I forgot his name. I can't remember right now. Maybe if I remember the name later on in the show, I'll be able to share with you. And he was saying that women tend to have, he was claiming, I don't know, of course I'm not the expert, that women tend to have a stronger immune system because of the XX factor. They have two X's, the X and the X chromosomes, I think, over men who have the X and the Y, and that could be a reason why women are dying, or at least women have a stronger immune system over men. Is that even true?
I've never read anything like that in my few years of reading, of learning medicine. But we've always learned that women are biologically more strong than men, but it's not with relation, and there's no relationship between the X chromosome and your immune system. So it's not, I don't think it's true.
Right. To remind our televiewers that it's okay for them to call. The numbers are up. We are ready and willing, very actually, to take their calls, to get their contributions, to answer their questions. Dr. Anita, we'll be very pleased to help you out with any doubts that you may have concerning the coronavirus. Now, while we're waiting, of course, we're going to continue talking. Now, if the situation with the figures in Cameroon continues, as in we're not getting any information for now, I mean, we'll establish at the start of the show that for the past couple of days we've not been getting any updates from the minister. Now, if the situation continues like this, what do you think is going to happen? If we stay in the dark, we don't know what's happening, we don't know who's getting sick, maybe you just see a video, a photo or social media of someone who is carried off to being buried because, you know, they died of a suspected coronavirus case. What do you think is going to happen? Is it helpful that we are not having is it helpful or harmful that we are not getting any statistics as it is at the moment, at least?
Well, not getting statistics, maybe it can be helpful in that there might be less panic, but knowing the figures is important. And I was just contacting some of my colleagues who are like, there are some updates, but it's not maybe as official as we usually have it, like on Twitter, he goes and posts this number of new cases, this number of, but I'm sure that they will start posting the updates. They will be giving us the updates. But one recommendation also is that we should individually know that this virus is there, and we should keep protecting ourselves. And at a certain point also, the CDC recommends that the lesser information even that you get is helpful for your mental state. Yes, so get the necessary information that you need, the new updates, but not too much information that is going to overwhelm you and make your entire day is you see COVID-19 all over the air, like when you're breathing in, you already feel your throat itching. So it's just the information that we get, there are some that are necessary, like getting the updates is necessary. It's very necessary for us to know, because if we start knowing, especially knowing where the new viruses are coming up, like if we're having a new case now, there are 4 regions actually that are hit by this virus. I think the Southwest, the Littoral, Central, and the South. So there are other regions that have not been touched by the virus. So it will be important for us to know if it has reached that extent, because the preparedness when you have not had a case and when you have the case at a certain level is different.
And since you've mentioned it, let's talk about the stress that comes with, the worries and the concerns about the coronavirus. How do you keep your stress down? You've mentioned the fact that it's important to not over-consume information on the coronavirus. At some point, you need to take a break, get the updates, yes, but do not, flood yourself or drown yourself in coronavirus information or news, because it's going to stress you out, and that's not good for you. So what are other things that people can do to manage the stress that can come with the thought that you're living through a pandemic? How do people manage their stress during this time?
First, there are some people that are really at risk of getting stressed a lot, especially those that are old, because they're singing every day that they are the old that are dying more. With those with comorbidities, and even teenagers and young people, they are not going to school now. It's affecting them mentally a lot. And you have, there are many other people, even the people who are not at risk, there's still some risks that you can get the severe illness. So with these people, the main thing is, the first thing, as we said, that they should try to curb the amount of information that you have. And also try to have, there are some countries that will recommend a lot of things because there's confinement. But still in Cameroon, we are encouraging people to stay at home more. Yes, to stay at home more. And you discover that when we are staying at home more, we start spending too much time with each other. And you start having to look at your spouse every day. And you start finding faults in how his nose is shaped and all those kind of things.
And the way he chews.
Yes, so it starts getting annoying and those kind of things. And so now is a time for us to maybe bear with each other. And one other thing that is recommended is to talk about it. talk with people that you are sure you can get good information with.
Not
them.
people who will stress you the more. No,
yes.
It doesn't help.
So sometimes also they recommend that you should talk with your neighbors, that how are they preparing for this? What are the measures they are putting? They might be doing something that you are not doing. You learn from it and you adapt. And you even talk to your spouse. Ask your children, how are they feeling? Like, how do they see you, even the way you react? Are you overreacting? Because sometimes you can just get too stressed and you get angry and all that. And sometimes one other thing that is recommended is to have a me time. Like a time where you just sit and not think about coronavirus, don't think about any problem, and just do something for yourself. Something that will make you happy, will make you feel peaceful. Maybe it's listening to music, or maybe it's just reading a book, or doing something, praying for some people, reading your Bible, or something that is just going to give you that peace and calmness. And so it's just encouraged to do a lot of things that will make you at peace. So avoid things that will instead be stressors to you, and things that will instead make you more and more worried. And keep trying to integrate the preventive measures into your life. That even when COVID-19 is finished, yes, it should be a way of life. You should wash your hands often, sanitize. You can still get another thing from somebody. Yes. So wash your hands often, avoid touching surfaces too much, all the preventive measures that we have put in place. And I think with those kind of things, and if at a certain point you feel too stressed and you feel too anxious, it's interfering with your sleep, it's interfering with your eating and all those things, it's good that you contact a medical facility and talk about it. There is somebody that can help you more to handle this stress. And people should realize that this stress is real. People can get depressed from this. People can get into anxiety from this. And if you get into anxiety, you should not feel that you are doing something wrong or you are not strong enough. Yes, so it's normal with a pandemic. There are a lot of people. And one other thing that is advised is that we shouldn't turn to dangerous means to protect ourselves, to deal with the stress, like alcohol, smoking, substances. Because some other people also that might find this very difficult are those that are addicted to substances. They might get more addicted, because some of those substances they take just makes them to forget about, so they might take more. So it's advised to stay away from those things, because taking smoking and all those things instead puts you more at risk of getting other problems and even dying from the COVID. Meanwhile, you won't have died from it if you had it. So it's just for us to find safer ways to handle the stress.
I'm glad that you mentioned the thing about cigarettes, because I was reading somewhere that smokers are more likely to be hit hard by the virus if they get it, if they get infected. It might be more problematic for them than it will be for non-smokers, because their lungs already have issues from smoking, and then when the virus gets in there, it becomes a problem. So now more than ever, those who smoke need to stop smoking.
Exactly. And if you find it difficult to stop smoking, it's actually a possibility that it might be difficult for you to stop smoking, because smoking is addictive. Now that's why we have mental health units in hospitals that you can go there. There's a mental health unit in Bopi Baptist Hospital. They can help you to stop smoking. Yes.
Because it's an addiction. We know it's not easy.
Yes, it's not easy. All kinds of addictions. They can help you. Once you're already addicted, you cannot stop on your own. You need help. So it's okay for you to seek for help. There are people that are ready to help you through it and keep you healthy.
Right. And before we go, one last question, Dr. Anita. Now, everybody is being asked to wear masks. Before, we were saying just those who are sick and medical personnel. Now, everybody has to wear a mask. Now, it's not just enough to wear a mask. It's important to know what kind of mask you should wear, what to protect you, and two, how to properly wear the mask. Now, we've talked about it on the show before, very first edition on the show on the coronavirus, but just to go back to it, if people are making masks at home, what kind of material should they use? If you're buying locally made masks, what kind of material should you be looking for? Should you just buy any mask or any material whatsoever? And also, when they do buy these masks, how should they be used? Okay, we have a call on the line. Hello, good evening. You're welcome about the diary. What's your name and what's your contribution?
Allô, bonsoir.
Bonsoir, messieurs. Vous êtes sur The Diary, vous êtes sur STV, à l'émission The Diary. Votre nom et votre contribution, s'il vous plaît. My French is bad.
En fait, je suis à Yaoundé.
Ok.
Je peux parler en anglais ou en français?
Bien sûr, allez-y.
Je viens juste de reprendre. L'émission est très intéressante.
Merci beaucoup.
La dame qui est assise est bénéficiaire de l'institution. Nous sommes affectés par le coronavirus. Nous remercions de la peine que vous prenez pour mieux bénéficier de la situation. Et j'ai pris l'émission en cours. Je voudrais savoir si, avant de nous, if medicine or the doctor and explain us maybe how to have an idea when this pandemic will take outcome. When this pandemic will be finished, because we are very afraid. There are people who die everywhere, and yesterday we have understood that French school is begun in the 11th of May, of the month of May. We are sure that Cameroon will be the same because we are already in the French country. I want to be sure because I'm sure that that girl figure is there. We don't have to explain ourselves. I'm there in front of my TV. I call later after the emission. I recall because I want to have the number of those doctors.
Well, thank you very much, sir. Merci beaucoup pour votre contribution. He asked a couple of questions. I couldn't hear everything, unfortunately, the sound quality, but I did hear something about when the pandemic is going to end and something about schools. I mean, as far as schools go, the authorities make the decision on when they're going to fling open the doors once more and allow students to go back to school. Once we get the credible information from the credible sources, of course, we'll make sure to share that with you on STV. And about when the pandemic is going to end, I know it's a big question. It's a really big question.
It's a big question because the pandemic, actually pandemics have two ways that they can go. They can either start and they have a quick peak and then they drop, or they have a steady rise and then they have a plateau phase and then they start dropping. And we are hoping to have the one with the steady rise so that our health systems will be able to contain the patients.
Yeah.
Yes, and get to a peak where we don't have new infections. And then you start dropping from the people that are recovering. And then finally we'll get to a point where we don't have cases. But you cannot put a date to when it's going to end. Because with this COVID-19, it's been established gradually that it's not seasonal like influenza.
Yeah.
Because with the pandemic of influenza, it reached a point now that influenza now became seasonal. But with pandemics generally, it will get to a point where we will not have many cases, but we can have spotted cases. In that case now, we'll be having vigorous surveillance at each centers. And if you have any suspected case, quickly isolate the patient and take to somewhere so that the patient cannot infect others.
Yeah.
So about the when it's going to end, I cannot say that.
Nobody can, actually.
Nobody.
No one can say. But like she's giving some explanation and you can know what to expect. Now, very quickly, we only have a minute or two before the end of the show. Let's get to the question of what kind of mask to wear and how to properly wear it.
Actually, you can make a mask from any household material,
Okay.
but with cotton. material that has cotton in it. Like this material I'm wearing is not very cotton. It doesn't have cotton. And the cotton is so that it can absorb secretions and keep it there, not because with the light material, even when you pour water, it just passes very easily. So it's very good too. And you should make the cotton to be recommend 3 layers. The CDC said max minimum of 2 layers. You have it, and the mask should cover your face and up to meet between your ears and your mouth. Let me say so. Yeah.
Somewhere on your cheek.
Somewhere. On your cheek, yes. And you should be under your
chin.
Your chin. It shouldn't be here. The way most people wear it. Some people just wear a mask that covers their mouth and their nose. No, it will not. It still gives space for secretions to pass.
Right.
So it has to be under your chin and above your nostrils. It should not just pass on top of your face like that. So with the people that are producing, they should produce masks that gives those dimensions that is able to go under the cheek. And the recommendation of the CDC is that children that are less than 2 years should not be given masks.
They don't need it.
They don't need it. Yes. Or people that are severely ill that cannot remove those on respirators, really, they might not need masks. But that one is left for the hospital to decide, not you. But us at home, there's no need to put a mask on your 1-year-old baby. Yes.
It's going to be really, it's difficult. I imagine trying to get my child to wear it's going to be, it's going to be a fight.
Yes. So, but for us, you can put on the mask. And then when you put on your mask, make sure you avoid touching the part that is exposed to the air. Because that's the part that is infected.
Oh, and it's so hard, but we have to make effort.
Yes, but the main thing now is that it's very hard. So, but when you make an effort not to touch, but if you do, make sure you clean your hands. Yes, and when you're removing your mask, ensure that the parts that are outside doesn't touch your nostrils or your eyes. Yes, so you remove the mask and you make sure that after removing your mask, you wash your hands.
Right. Well, maybe we'll come back to this again on another edition of the show. We'll talk about this some more. Thank you so much, Dr. Anita. I'm so glad and very happy that you're able to make our time to be with us on The Diary with everything that's happening and all the craze in the hospitals. Well, televiewers, that's it for today. Thank you very much for your kind attention. This show is going to be on YouTube. All you have to do is go check out our YouTube channel, STV Cameroon. And of course, you can watch The Diary and other shows on that channel. Well, take care, stay safe, okay? Bye-bye.